Guys, I know I look rough, but let me tell you, I wanted to make sure you saw what the face of mental exhaustion looked like. Today, I wasn't at the bedside. I was actually doing a mental health rotation, um, which I did yesterday as well in the same place. I am so mentally drained that when I got home today, I I don't even remember when I fell asleep. I fell on my bed. I even still have my uniform on, guys. That's nasty. I fell on the bed like a murder scene. My legs were like this way, dangling off the bed. I was like, it was the next thing I know, I woke up like half hour ago. No, like 45 minutes ago, took a shower, stayed there for like 20 minutes, and I don't even know what hit me. I was so disoriented. That tells you how the power the brain has. It's just like, I'd rather be at the bedside with 15 million patients where my body's tired, and you do use your brain, obviously, because as nurses, critically think and all that, and you're always solving problems. But when your brain is done, it's done. And I felt that my brain was fried today. And it's a culmination of 2 days, and it is a really important topic, and I think I'm going to expand on it in another video probably tomorrow that I kind of can think better. We're dealing with a patient in this hospital in Philly with my students. Thank God, I am so grateful that one of my students knows sign language. I mean, she did this as a minor. And I realized how I need to learn. I felt very incompetent, and I now I understand what people that don't know English feel when they're listening to someone that they're talking English and they don't understand. I felt like I couldn't help this patient, but I'm so grateful that my student was able to, because this facility, guys, did not have someone that can interpret for this patient. If it wasn't for my student, this patient would be thought of as someone aggressive that had mental illness. And no, all that this person needed was his teeth, several teeth pulled out because he had such a bad infection. Because in the place where he resides, in the group home, that's my dog trying to go outside. Oh my God, I don't even have energy to open the door. They neglect the fact that they needed to take him to the dentist and have these teeth extracted. So he was acting violently, and oh my God, what's on my eye? I'm having like eye dryness. I look like a prisoner. Oh my God, I look terrible. But I wanted to show what the reality is. And he couldn't express to them what was going on, so he acted violent, and he knew that if he did that, he was going to be taken to the hospital. And he did, but then no one in that facility, in that mental health department, could help him because they didn't have interpreters for him, for sign language, and I was so upset. And then my student, who didn't have to do it, she made it clear she wasn't interpreting. She was just making sure that they knew what he was saying in terms of his communication, because he couldn't. He was so upset because they couldn't understand him, and he clinged on to my student, and it was a great thing to see. But at the same time, I'm like, how about if we wouldn't be here? And would they even know what's going on with, I mean, it drained me yesterday, and I said, I'm going to go in there today, and I hope that they did the things that I wanted done. Everyone deserves to have someone to represent them. Just like patients have nurses that are taking care of them, physicians and healthcare providers are taking care of them, listening to them. I mean, as nurses, you have to do an assessment, right? You're asked to have questions throughout the day. So how were these nurses doing that if they couldn't communicate with this patient? If my student wasn't there, and we were only there for like 8 hours each day. Today we left a little early. I'll tell you about that. And then today, we get there and still the guy's not giving antibiotics. I mean, it was just a mess. And I said, you know what? I'm going to pull. I was thinking about this since yesterday. I said, if they don't do right by this patient, I'm going to call the Patient Advocacy group. Shoot, I was going to call the state, and I made it known that I was. And guess what? They went to medical rounds, and the manager said, oh, you know, we need to do something now because we've been threatened that we're going to call the state. And guess what? Things started moving. Things started moving. Why couldn't it move yesterday? Why did it have to take me threatening you to call the state? Because this patient is unfairly being treated and not by the law. They're supposed to have someone with him 24/7 to interpret what he says, to interpret like his answers to an assessment. How is the nursing even, what are they even writing? Because they don't know what he's saying. And then, you know, the person is deaf. So then they go like this, sir, can you he doesn't hear you. So they're talking to him like he can hear, and he's just, you know, has an ear infection, and maybe you have to talk a little louder because he has hard of hearing. No, he doesn't hear you. So I think it was such an injustice, but at least today things were moving. And then at the end of the day, when we're leaving, mind you, my student, this patient has been clinging on her. The interpreters came right now, right? This patient was admitted on Sunday, I guess. And a therapist that hasn't even known the situation has the audacity to tell my student, oh, you can't interpret, and talk to her so rudely that my student had to take a break, and she was so upset. And you know what? I do not allow anybody to talk to my students any sort of way. I am, just like I'm protective of my patients, I'm protective of my students. And I will never allow anybody to disrespect them or make them feel anything below what they are, because my students are great. And guess what? We all left. Okay, so they're gonna act that way. We felt bad and everything, but then at least I know that things were gonna be moving. And let me tell you that I have friends at that place. So I will be making sure, and I'm gonna be going away for a couple of days, but I will be calling from where I'm going and checking in to see what's going on. But I just want you guys to see what mental drain looks like, and I look straight up like I'm going to a mugshot, because I am, look at this. I'm looking rough, guys, and I'm sorry, but I needed to show you. Honestly, like when I woke up, I didn't even know my name. And I know you guys might be laughing because it does sound funny, but I am so mentally tired. But at the same time, I'm like, you know, it was worth it, because being a patient advocate is what we are. You know, we need to make sure that our patients are being treated like we would like our family member to be treated. You know, our loved one, whoever, that, you know, we can, anybody, even if we don't know them. I mean, I just met this person yesterday, but I saw the injustice, and we had to do something about it, and things started moving. But imagine all those people that don't have that person fighting for them. And that is what drained my brain. I've had this patient in my mind since I met him yesterday. And I went there and we went through all this, and I'm still thinking about it. And I think that's why I am so tired. And I'm not going to stop thinking about it, because that is what we are. We care for others, and that's why we choose this field. And, you know, I know that some people choose this field for the wrong reasons, you know, monetary gains and all that, you know. I didn't. I'm not saying that it's not good money, but I'm just saying that that's not why I chose it. But I'm so proud of my students and how they handled the situation, and I was glad that they could see what speaking up for somebody can do. So I just wanted to share that with everybody. If you have any questions, let me know. I'm going to be making a video on things that some of you have commented that are entering nursing programs, that because you know how hard they are, and what are the things to look for and how to prepare. So look out for that. But in the meantime, look at this sorry face that is so tired, and looks rough, but you know, tomorrow I have a hair appointment, so you know that's gonna be changing, okay? All right, well, have a good night, guys. Bye.